the greatest challenge. Everything else is comparatively manageable. But how do we masses to be motivated to follow healthy practices is actually the greatest challenge. And I think at least in our country, that will continue to remain a challenge. When you see on Marine Drive of a greatest city of our own country in Mumbai, people come with the Mercedes and BMWs, and when they walk on that footpath of Marine Drive, they start arguing that why should I wear the mask? Now, if that is the situation, what do you do?
Yeah.
That's some of the challenges that we are facing. Yes.
Yeah, a good friend of mine at CDC used to tell me that if you are sick, you go to a clinician, your clinician. But if the whole neighborhood is sick, you come to me. And that's what public health is maintaining health of the public. And that is so true what you're saying in your context too. So
we've got 2 more minutes. Yeah, we've got 2 more minutes to start. I think Shivali will play a video first. We're waiting for Mr. Subhash. It's already here. Mr. Sanjeev Deshmani, I think he's joining us in a minute or so. So I think then we hopefully are like good to start. Yeah, we've got a minute or so. Shivali, you have a video, everything ready. Dr. Subhash, I was reading about your, the assessment of the second wave and how you actually, picked that the intel actually, how it started from Maharashtra, and nobody listened to that intel at the start. And that's really that's such an insightful, and I feel like that could have really, if they have taken your advice that time, it could have really saved thousands of people actually.
I think so. Really, I still believe, even now, what we, my plea with the, people who are at helm of the affair is to be absolutely transparent. You see, right now, we need to know what kind of viral mutations that we are going to really face. What information do you have locally? Locally means at the national level, from Indian context, that is available with you, and something which is not available, admit it. Saying that, well, we do not have, but these are the probabilities, and this is what needs to be done. So come up front, and that's one of the major problem that we faced for the second wave in the month of Feb, when I was there in Vidarbha, and right in the first week or second week.
It's really insightful. We were going to cover that for sure in the discussion. So Shivali, you can go ahead actually. Yeah. Hi, good morning.
A year since the COVID-19 outbreak, the pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India. Time to reimagine the future. It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India, time to reimagine the future.
Thank you so much. A very good morning to you all. I think it's the perfect line to begin with. Health of India, it's time to reimagine the future. And this is the tagline that we are starting. A really warm welcome to all our participants, all our speakers here for the Health of India Maharashtra E-Summit. I take this privilege and honor to thank you all. I know it's a very, very busy schedule for all our guests, for all our speakers, but thank you so much for joining this really, really important discussion. I know for the last couple of years, we've been facing, more than over a year and a half, we've been facing the COVID-19 pandemic. All of us have been really, really badly affected by it, some way or the other. So we thought that this discussion right now is really, really important. So with that, let's start our day. Allow me a minute to share my screen. Perfect, here we are. So this is the Health of India Maharashtra E-Summit series. This is actually a series that we're going to do in the 8 states across India. We're starting with the Maharashtra today. It's been more than a year into the COVID-19 pandemic, and it's now time to take stock of how healthcare and life sciences have managed to cope with the stress and discuss strategies actually that have been developed to address the gaps and maybe vulnerabilities, that were witnessed during the COVID-19 pandemic. The pandemic actually has created an unprecedented situation and a very, very uncertain time in terms of global health across, but it has also at the same time created new opportunities for future partnership towards robust solutions in healthcare and life sciences. It's time right now, like we started, it's time right now to reimagine the future, and the time to act is right now. A line of introduction here. My name is Surbhi Pandit Nangia, and I'm the Director, Outreach and Partnership with Data Leads. On behalf of Team Data Leads, Health Analytics Asia, and our esteemed partners here, SAP and Entity Data Business Solutions, I extend a warm welcome to all our esteemed speakers and guests for the Health of India Summit. And we hope that you will continue to join us for the other series as well. Why are we here today? I mean, we've been attending a lot of webinars. We've been online for the last couple of years or so. But why are we here today? The Health of India series, which is presented by SAP and Entity Data Business Solutions, is convened by Health Analytics Asia and hosted by Data Leads as part of a Pan-Asia Health Dialogue initiative to build a committed platform for strategic collaborations in the ever-evolving areas of health and life sciences. This entire series will feature health ministers, policymakers, top CEOs, thought leaders, technologists, journalists as participants in high-level deliberations on health with specific focus on innovation, technology, and policy making. This series, like I said, is spread over 8 states. The series will highlight pivotal perspectives of the states that drive India forward, promising to shape the country's healthcare and life sciences ecosystem in the years to come, so that we don't face the problems that we faced because of the COVID-19 pandemic that happened in the last 1.5 years. So it's time to discuss and take the conversation forward. Before I move any further, I want to take a moment to introduce Data Leads. Data Leads is a digital media and information company which aims to help people understand and also engage with the world around them. We work with the world's leading media and tech companies and regularly partner with them in various collaborative initiatives that we've been doing for the last few years. Our work spectrum actually varies. It includes capacity building initiatives, fact-checking initiatives, media research, data-driven content, and events with a special focus on building collaborations specifically on public health. We are also very proud partners of Google News Initiative and Internews in launching and pioneering actually information literacy and fact-checking initiatives in India, which has benefited over 1,100 newsrooms, organizations and 700 plus universities, education institutes across India. We started the Google News Initiative program actually in 2018, where we chose 250 journalists and media educators, and we equipped them with basic skills required to fact check any kind of information. And ever since, this program has been running very, very effectively. Health Analytics Asia, this is another flagship project of DataLease, is Asia's first actually, and it gives me immense pleasure to say that it's Asia's first data-driven health information platform, building collaboration between journalists, doctors, and technologists. Our approach to build collaboration with doctors is globally recognized as a unique initiative in healthcare reporting, and it has won, in fact, the membership puzzle project by the New York University. We've also been awarded by the prestigious BMJ Awards. We are really, really proud of it. There is another initiative that is really, really dear to us, which is an integral part of the Health Analytics Asia, and it is called First Check. It's the entire map that you see in here is our collaborations with the doctors across Asia. In fact, it's moved ahead of Asia. This is a collaborative initiative with doctors to fight the tide of misinformation related to public health. So any kind of misinformation that comes on any of the social media platforms, these panel of doctors help to debunk it. It has recently been selected as one of the 7 fact-checking initiatives that will benefit the broader global fact-checking ecosystem by the Fact-Checking Innovation Initiative, which is a joint venture between the Facebook Journalism Project and the International Fact-Checking Network at the Poynter Institute. So let's begin the day here. We know there has been an online fatigue, and keeping in consideration that people have been going online, and we've been already Zooming and meeting online for a long time. So we thought let's keep this session as crisp and as focused as possible. So the agenda is very clear, is very crisp. We start with one panel discussion. We have our eminent panelists already here with us. We move on to a 5-minute poll survey, and then followed by a session on flash talks. We've started exactly at 10 o'clock, and we will try and wrap it exactly at 12 o'clock. We understand, we respect that your time is important. So thank you so much once again for joining us. And this gives me immense pleasure and pride. Here is the entire panelists who are here with us today. I want to take this opportunity to set up the stage for the first panel discussion. Ideally, in an ideal circumstance, we would have done this in person. We would have come up on stage, met all of you in person, including our speakers here. But the COVID-19 situation actually doesn't permit us. But nevertheless, I think we're going to make the best of the situation that we are in here today. So I would like to thank all our eminent speakers for the 2 important sessions and for taking out the time to be a part of the series and discuss the future of health. It is really, really important for our participants and all of us present here today. For the Maharashtra East Summit, 5 leading voices with expertise ranging from healthcare to pharma to global health to COVID-19 management will actually share their ideas and vision about the challenges and new opportunities ahead. The plenary session will be followed by a flash talk presentations delivered by health trailblazers on exploring new avenues, taking calculated risk, and setting up the stage for recovery. And we are so hopeful about that. Thank you so much. With that, I would want to introduce our eminent panel who are present here today. To begin with, I would want to invite and introduce Dr. Subhash Salunke. Dr. Salunke is currently the advisor on COVID-19 to the government of Maharashtra. He also serves as Senior Advisor, Health System Support Unit at the Public Health Foundation of India. Dr. Salunke navigated various portfolios in public health and has assisted governments to initiate a number of schemes focusing on health services to the poorer section of the society, which is really, really important. He was actively involved in formulating projects such as health system development for specifically Maharashtra, and has led the design of the HIV AIDS control special program, which was called AVERT, with the assistance of USAID for Maharashtra. Thank you so much, Dr. Salunke, for joining us today. I know it's extremely busy right now, but we really, really appreciate the time that you've taken out. With that, I would now want to introduce Mr. Sanjeev Deshpande. Sanjeev Deshpande is a board member and managing director and CEO of Entity Data Business Solutions India. He has over 26 years of diverse and rich experience, including 6 years of management experience in the field of industry. With almost 20 years of experience in the IT industry. With this strategic leadership and his skills, as well as deep business and industry skills, Sanjeev is a proven technology and digital solutions coach. Thank you so much, Sanjeev, for partnering with us and also being present for this very important panel discussion. Thank you again. Moving on to our next speaker, I would want to introduce him, Dr. Altaf Lal, who's a public health specialist based in USA. Dr. Altaf is the senior advisor for the Global Health Innovations at Sun Pharma. He's member of the Rollback Malaria Partnership Board, RBM, Asia Pacific Leaders Malaria Alliance, and advisor to the board member Foundation for Disease Elimination and Control of India. He has served as the director of FDA India office and US Health Attaché and regional representative for South Asia at the US Embassy in India. Dr. Lal has also worked towards building a bilateral and multilateral partnerships, which has led to significant growth in collaborations at academic, institutional, industry, and at the government levels. That's a lot of great work that you've done, Dr. Lal. Thank you so much for joining us and for coordinating with all this. Thank you so much. I now take the opportunity of introducing our next eminent panelist for this session, Mr. Annaswamy Vaidheesh. Mr. Vaidheesh has a track record of over 35 years in healthcare and FMCG industries in multi-countries, actually, which is focusing on sustainable and responsible growth. Currently, he's the CEO of North Star Alliance, North Star Asia LLP, management consultant and senior advisor to many companies, which includes the PAG Holdings Hong Kong. Mr. Vaidheesh was also previously the managing director and VP South Asia at the Global Time and MD of Johnson & Johnson Medical South Asia and VP of Asia Pacific Diabetes Franchisee. He signed, this is something really important, he signed and executed the MOU with China Communist Party School for healthcare initiatives for Johnson & Johnson. He is the honorary fellow of the Minimum Access Surgeons Association of India. Thank you so much, Mr. Vaidheesh, for joining us today. I also actually wanted to introduce, we had another panelist who of course needs no introduction. We were supposed, Dr. Naresh Trihan was supposed to join us today, but something really, really urgent came up and he couldn't join this panel discussion. Dr. Naresh Trihan is the chairman and managing director of Medanta, the Medicity, but I'm sure we would find in opportunities in the series to come that Dr. Trihan would be able to join us. But thank you so much. I understand, because this is a time where all of us are actually, fighting. The entire panel here have been fighting the COVID-19, so we understand that something could come up. With that, I would request my colleague, Syed Nazakat, who's the founder and team lead of Data Leads, to take the conversation forward on this panel discussion. Thank you so much, everyone, for joining us.
Thank you. Thank you so much, Surabhi. Thanks a lot. Thank you so much for introducing the panel and setting the stage for this really important discussion at a very unprecedented situation. I personally strongly believe that no matter how hard the situation gets, there is a solution to every problem the humans face throughout the history. There has been no problem in the world, but there's no solution. But the challenge often comes the people who know the solution, either they don't talk, or when they talk, people do not listen to them. So the whole concept behind this summit essentially is to bring the major thinkers, the prominent people with expertise, people with who have been in the field, who have led the partnerships and discussions, to bring them closer on this very important discussion. Because we were having a chat before the session with Dr. Subhash, and as I said, we never ever imagined that we will face a situation like this. And I remember, just to put a quick note at the start, I remember when it happened in Wuhan and there was a first outbreak, we have a Chinese colleague with data leads, and we were meeting in Delhi, and I was asking her, what is this happening in Wuhan? There's some virus. And we reported, I think our data leads was perhaps the first company to report the outbreak and what was happening in Wuhan because of our Chinese colleagues there. And we have no idea that it will become such a global crisis and tragedy and all. But I think we still, no matter how hard it becomes, if we think of future, we need to talk. And we need to listen also to people who know the answers and who know the right questions. So this whole dialogue series is an effort to bring the brightest minds together and have a new discussion about moving forward. So I can if I ask my panelists to start with like a maybe opening a couple of short remarks about what do you think, where do we stand after more than a year of COVID? And whether what are the challenges you think we still face in terms of moving forward in next 5-6 months, which are very crucial. We're in the middle of massive vaccination drive as well. So if I start with Dr. Subhash with you, you're advising the Maharashtra government, and you have been a forefront of actually leading this initiative in one of the India's major states. How do you see the situation now, and what do you think has been our key learning in the last more than 1 year? Dr. Subhash, your microphone is off.
Am I audible to you now?
Yes, sir. Yes, sir.
So I wish to thank all of you for giving me an opportunity to express some of my views. First and foremost, you have indicated that what is likely to happen in next 5-6 months, particularly from the perspective of Maharashtra. I'm sure all of you will agree it is not Maharashtra can be considered as a standalone entity. It has to be linked to the nation and to the global situation. I anticipate in Maharashtra the areas, just all of you are aware, Maharashtra is as big as many, or bigger than many countries, 130 million population, a huge area. I mean, every sort of an coastal area, tribal area, everything you name it, and it is there. So it's a huge state. But within that state, you find that Western Maharashtra districts are continuously showing upward trend, or it is not showing downward trend as we are seeing in other regions of Maharashtra. Like we have seen a decline in Mumbai, decline in Pune, but that decline is not seen in Kolhapur, Sangli, Satara. That's the point of worry. Just a couple of days back, we had a meeting with the Honorable Chief Minister, with all the district collectors and officials of the administration. So I indicated to him, sir, I said, sir, Maharashtra at this juncture seemed to be going into the direction of what we call as a endemicity. We are not going to see a decline to the desired level throughout the state as some of you are anticipating. It won't be zero ever. Sorry, not ever. It won't be zero in near future, but it is certainly going to remain downward trend in some districts, and it will not be that downward trend in some districts, and it might plateau. And if it is going to go upward, then that's the point of worry. What will save us, according to me, only two. It's not only for Maharashtra, it's true for the India. If we do not vaccinate at least 65 to 70% population by 2 doses throughout the India, at least by December. December is late. This is what I told the national level colleagues. I said, December is late. We should have been able to accomplish this by August. But even if we accomplish this by December end, things will be under control. This is one and foremost intervention that needs to be done. And second one is that, for God's sake, irrespective whether we vaccinate 60, 65, 70, absolutely no choice but to implement the COVID appropriate behavior, no choice. In Maharashtra, our recommendations to the Honorable CM and Deputy CM is that please do not relax the restrictions abruptly, as it has been done in some states like in Delhi. I'm very unhappy with the way things have happened in Delhi so abruptly, and I'm sure it is likely to give a backfire effect after some time. That's my anticipation. If I'm proved wrong, I will be the most happy person. But no abrupt kind of relaxation, gradually taking into considerations what situation is there district-wise. Districts are also quite fairly big. Like Pune, we have 1 crore 30 lakh population. That is, huge, bigger than some of the countries. So the point that I'm trying to say, we need to take into considerations the challenges that we are facing. And the major challenge we are going to face is not only COVID, we have to also take into consideration non-COVID activities, our immunization program,
Right.
The diseases which are coming into this particular rainy season. So health systems are already overburdened. They are already under stress, under duress. And now we are going to get, sort of a possibility of pediatric age group getting more affected. So I think we are really doing firefighting, but if we have a balanced approach, we will be able to contain the present challenge in the next 6 months, provided these 2-3 principles are followed. Thank you.
Dr. Altaf Lal, how do you see what is our biggest challenge right now in the current situation? Your microphone, Dr. Altaf Lal.
Syed and Shurbi, let me also first thank you for hosting this and thank you for inviting me. I wanted to go a step back. Before we got started, we were talking about the Spanish flu, the 1918 pandemic. I think like 1918, 1919, we have some commonalities with today's pandemic as well. But we're better informed. We are better communicating with each other compared to then. And we're challenging each other better. But in that context, I wanted to bring up certain key structures, processes, and elements that if we combine and address together, we might have a better outcome. What Subhash said was fact-based communication, if I summarize what Subhash said. People on one side who are affected, they live in different demographics, in different economic strata, rural, semi-urban, urban, providers of healthcare. These are clinicians who know how to treat a individual at a time. Then you got public health professionals like Subhash. They look at communities, they look at states, they look at provinces, they look at countries, and they all think differently. Then you have producers of medical products. I think we're fortunate that diagnostic tests were created in rapid time frame. Repurposing of drugs was undertaken. Vaccines were put in people's arms within 2 years of start of programs. We have not seen that anywhere at any time. The policymakers who have to listen to people like Subhash, who have to understand how to communicate Maharashtra. Communication has to be in Marathi, it has to be in Gujarati, it has to be in Urdu, it has to be in Hindi, and many South Indian languages, because Maharashtra, Mumbai is a melting pot of many different cultures, many different backgrounds. And the last piece is the political leaders. I'm so happy Subhash said he talked to the chief minister, the deputy chief minister, or the health ministers. It's at the end of this chain of P's I described is your political leaders. If they do not communicate in an honest manner, repeatedly, in a manner that people understand. I'm going to give you the example of Delhi situation with oxygen. When I was in the US, there were multiple messages. We have oxygen was coming from one, the political arm of the Indian government. The other arm was saying, we don't have oxygen. Well, you either have oxygen or you don't have oxygen. You can't have both. So this real-time communication that's factual is absolutely critical. talking to each other versus talking with each other. So those are my initial observations, Sayed.
Let me come to Sanjeev, to you actually. Looking at the challenge, it was also a technological challenge actually. And there are learnings how actually technology played some role here and could play better in the future. How do you see the challenges in terms of actually use of technology in a crisis like COVID?
Thank you, Syed. And again, thank you all the panelists. The technology, the shining example is Covaxin. So if you look at the Covaxin, the platform that got created in India, more or less is the one that was developed by SAP along with a very large telecom company in Germany. So Covaxin, and we are also now heard the news that it is being released to the rest of the world. Anybody who wants to use it. That platform has shown us what is possible in terms of integrating the data across multiple hospitals, across multiple districts, multiple states of the country. Imagine if we had this integrated data analytics system beforehand, 5 people in 5 different hospitals were reporting the same symptoms. That could have helped us predict the outbreak of a pandemic much quicker. But we didn't have that in place. We have acted after the fact. But nevertheless, the speed with which it was developed is amazing. Today, we are vaccinating the people. How do we make sure that no, we are reaching the right people, the people who have not been vaccinated, where to emphasize, put our focus? All of that is possible because of the Covaxin platform or platforms like that. Arogya Setu app is another shining example of what is possible in terms of protecting people in times like this. But if now this pandemic at some point will be over, right? And as Subhash Salanke ji said, by December, if we are able to vaccinate most of our people, at least 60-70% of our people, then probably we will be out of it. But then what happens after that? If you look at our primary, secondary, and tertiary care systems, every one of these today is extremely overloaded, and it will continue to be overloaded if you look at the statistics and compare ourselves with the rest of the world. From that perspective, the remote consultation, video consultations, telepathy, or the telemedicine are made possible through robotics automation, data being read by AI, ML. So you do a lot of right prognosis and diagnosis as you are analyzing the data. So our ability to expand the reach of the medical supervision monitoring is going to be much higher if we adopt the right technology, and which is going to be necessity today, and which is going to be most necessity probably after the pandemic is over, because people are getting more and more conscious about health. And viruses, I don't think it's going to get over by end of December. I think it will continue to mutate, probably with us for next 3-4 years. From that perspective, it is an urgent need to have an integrated data platform across the country put in place much sooner. So it might take another few months to put that together, but I think we need to invest in, because Covaxin just to track the vaccination is not going to be enough. I think we need to be able to get the data across hospitals and bring them onto one single dashboard.
Wonderful.
That should help.
Wonderful. Vadesh, if I come to you, given your experience of working across the region and working at different leadership levels, and then seeing also the situation of the last 2 years, globally we're all in actually. What do you think overall? Why do we stand even at a national or global level in terms of our fight with the COVID? How do you see the situation in next couple of months? What could be like our key challenges here?
Thank you, Syed. And I must say, first and foremost, thanks very much for this August panel with such great wisdom out there. A couple of points I would say is that I think the title that you talked about, the reimagine the future, actually the COVID has already made us to reimagine the future. As Dr. Altaf has just mentioned, there is an unprecedented work that is being done by almost many members of the ecosystem. I could never imagine a drug discovery happening in a matter of 1.5 years' time. I've been in the industry for donkey's years, I know for sure that what it takes more than 8 to 10 years to get a drug. Here we are talking about getting a vaccine out. And very interesting thing is that a concept like mRNA technology platform, which has been in the fray for the last 25 years. And this whole mindset of making things happen, people wanting to try, because the pandemic has made us all to think very differently. So first thing that I would say is that the landscape of healthcare has changed dramatically forever. The whole concept of collaboration amongst the stakeholders has gone up leaps and bounds. Now, no longer each one of the members and the payers don't look at a provider as an adversary, or a regulator doesn't think the pharma company is an adversary. Today, we are seeing an unprecedented collaboration, trust, and people are willing to give in things which would have normally happened. So first and foremost, I would say that whatever bad things happened as COVID, because people have lost their life, at the same time, I would say we have made a significant progress as a solution that we can bring in future and solve the future pandemics. A couple of, so I would say that we should congratulate ourselves. Country like India, people used to say we have a very different healthcare system as compared to developed countries' healthcare system, which is ours is a far more supply driven financing mechanism. Some countries have a demand and supply side financing combined. And each one of them had a very advanced, so-called advanced, dealing with the chronic diseases. Look at the way which India has responded. Frankly, in my opinion, everybody's in the same stage, but India has also stepped up. And frankly, in my opinion, an example of Maharashtra was given. What kind of innovation that we are doing to deal with? So first and foremost, we need to recognize before we start saying that what we should be doing, I think what we have done is phenomenal. So I would like to recognize. Before I leave a couple of thoughts, which we can pick it up later, first and foremost, now I think it's time for us to look at how can we prevent, take certain action, because the patients or the public is ready, they are listening, policyholders are listening. This is a time for us to ramp up huge preventive healthcare program in place. I have a few suggestions that I'll talk about as we go along, but I think this is the right time to start putting some such powerful programs and enroll our population into those programs.
Wonderful. Thank you so much. I think this really well said, to be honest, like unprecedented situation, but it has also thrown out some insight which could really empower us as we move forward. I think one of the key things, in the whole discussion is also, I think the data, the health data, and access and collection and understanding of their data, so that our policies at the end of the day are driven by evidence. And I will come back to you, Dr. Subhash. Like you have been advising the Maharashtra government. Why does the data, fit in the picture? How is really policy driven by evidences of the ground? I know you have been one of the, I think, the very first person who was able to identify the second wave in Maharashtra, but somehow I think the message was not picked up. So, what role do you see in the future of health, of how data should actually help us to take better decisions? Yeah, I think so. Your microphone is yes. Yes.
The data is the foundation, and that is appreciated by everyone. I'm so delighted that in a district like Pune, the rural area, the most peripheral functionary, whether it is the community health officer of a subcenter or an A&M or an ASHA, they are now aware about the importance of the data, appropriate entry as far as the data is concerned. So basically, decision making now in Maharashtra is totally driven by the objective data collection and its interpretation. That great achievement has happened because of, as Dr. Deshpande, Mr. Deshpande has indicated, COVID came into picture and we had initially a lot of problems, but that now has got stabilized. And that is the anchor sheet as far as the decision making is concerned, COVID. Now, one more thing that is happening because of this, all other programs, Maharashtra is one of the states where the disease surveillance program has been established quite early. And now the use of electronic media, even a simple tool like Android mobile phone with the ASHA and ANM has become a very critical issue as far as communication of the data is concerned, and revalidation, re-verification, everything is being done without being used, these terminologies, and people are using it on the ground. That's the beauty of this entire thing. Maharashtra is also benefited because of two extreme, important policy decisions taken at the highest level with the chief minister. Like, he said, do not hide any death rate. Absolutely no hiding. Don't hide number of cases. Don't hide deaths. Don't hide complications. Absolutely.
So you're saying there's a clear political message to
Absolutely.
you and then to your colleagues.
Everyone, we are, like, I won't say exceptional. There are other states also. But in Maharashtra, maybe when you see that, oh, so many cases, oh, so many deaths, we are absolutely crystal clear, and reporting is no hidden sort of, there is no agenda to hide any data. And that is the reason whatever is being presented today in the national platform or international platform, Maharashtra can with confidence say that we have a fair amount of accuracy. And as I explained, data is generated at the most peripheral level. Its importance is appreciated, and it is also being used for decision making at the district, at the divisional, and at the state level. That's very positive point.
Wonderful. I think that's good to hear actually from someone who really is advising government and keeping the data as a foundation. I know, Dr. Altaf Lal, you have spent most of your life actually with data as a public health policy advocate with malaria, with so many other initiatives globally. And I just wanted to know, how do you see the use of data and the evidence essentially in terms of the pharma, how they reacted to COVID particularly? We saw vaccines, we saw clinical trials going at an unprecedented scale and speed. What has been the learning with particularly with the pharma in terms of data?
Sayed, I just wanted to follow up where Subhash left by saying data is gold in public health. You have good data, you got a lot of good gold to work with. You got bad data, you have nothing. So I'm so pleased, Subhash, you mentioning that the Honorable Chief Minister is directing to get the real data out. It's only when you have the real data, you can make real policy decisions. I think COVID may be teaching us something within the confines of India and perhaps other countries, that get the real data out. We fight this absence of good data in malaria, in TB, in chronic diseases. So at the end of the day, the published data is you only have 20,000 deaths because of disease A. One, policymakers say, well, is it really worth investing significant amount of resources, human resources, money, et cetera, when the numbers are low? And pharmaceutical sector at the same time takes a view, where do we invest public money? Because pharmaceutical sector also uses your money. Where would we impact the best public health for a disease which has lots of cases, lots of death, et cetera, et cetera? So I'm so happy that COVID may be actually advising policymakers, political leaders to be transparent, to be honest, and to be upfront. When globally, and I say this from the perspectives of what I have picked of India, but outside India, the information would be, well, 300,000 deaths, but it could be 3 times 300,000. It could be 10 times. So this could has to disappear. Maharashtra has to lead this effort, and other states have to convene similar strategies, that if we report 10,000 cases, it could be 10,000 plus 20 or 10,000 minus 20. It can't be 20 to 60 to 70. So Subhash, kudos to you. Kudos to government of Maharashtra. And this is Sayed, where Maharashtra and other states that are on similar things could take the lead and have a nation that is based on facts, nations based on data.
Sanjeev, how do you see, you deal with data, your company deals with data, you provide solutions. how do you see actually the challenges in terms of data collection and making sense of because we have seen in India, the data is in silos, and we know we have a data in different languages, in different formats, and one of the major reasons why we do not have still a lot of like action and planning on based on data, because it's not really at one place somewhere down the line. Though we have a session in the second half, we're going to launch something very special today at the end of the summit. But I just want to come back to you and take your insight. What are the challenges you see in terms of making really data as our as a principle moving forward in terms of public health and life sciences?
Right. So as Mr. Subhash Salanke said, if the nurses, the staff, the primary, healthcare or, whatever hospitals, if they're collecting the data of who is coming, their age, their gender, the symptoms, that's fantastic. But then what happens after that, right? So there are 2 or 3 different sets of data that needs to be collected. We in India, electronic medical records, for example, are not even available between the 2 different facilities of the same hospital chain. Government hospitals are totally disjoined from each other. So let's say we collect the data. I mean, I come from a small town in Telangana, which is bordering Maharashtra. And we know the situation actually on both sides. Tremendous improvement over the last 20 years and a lot of good things are happening. Nevertheless, do we have the type of the hospital management systems in each hospital, which potentially could be then linked over a, what I call a cloud system of data analytics that will then help us do advanced analytics on that or do some kind of predictive analytics, because we have the data, but then how do you derive the insight from data? Because you have a lot of data, absolutely fantastic. But what do you do with that data? The data can be overwhelming if you don't have the right tools to mine the data and derive the right information. In my mind, the focus has to be, yes, first of all, we need to collect the data, all types of data, not just the patient statistics, but then what is happening with that patient, what type of treatments, what type of symptoms, what type of drugs are being prescribed, and what is happening after the prescription of the drugs. That would help pharma companies understand the effectiveness of the medication that is being given. It will also help change the course of the treatments. Today, a lot of that is happening. Of course, ICMR and other bodies are collecting the data, but it is not happening seamlessly across different hospitals. That's why you would see if you go to one state, one hospital, you might get slightly different treatment for the same thing if you go to some other hospital. I think there's a lot of good things that are happening, but I think we need to go on all out, collect all the data. It's not just the patient incoming, checking outs, but I think during the course of the treatment, also a lot of data just gets generated. If you go to, let's say, for hospitals in US or Germany, other developed nations, through wearables, through smartwatches, through sensors, there's a lot of data just being collected on an individual itself, so that they are able to fine tune the customize the treatment just for that individual. In fact, the individuals are being connected to the healthcare even before they show up at the hospital store. So the preventive care is so good that actually relieves the load on the hospital system. So from that perspective, individual data plus the data from at the hospital level, regional level, district level needs to be collected in all aspects, need to be integrated into a district level, state level, and nationwide platform. Otherwise, we will not be able to drive the right data analytics. I think Germany, for example, we along with SAP, there are some certain states where there is such platform that exists. A lot of good data mining is happening, and they're able to derive some very good insight from that data.
Wonderful. Let me come back to Videsh, to you actually, in terms of when we look at future and we look at the data, we also see there has been a change in our own understanding, because data can actually tell us something is going to happen if we have access to right data. And there has been, I think, a larger global consensus somewhere down the line that eventually we have to put more focus on preventive health, preventive medicine. Instead of treating and doing surgeries, what about making sure that people do not fall sick? And I think during the COVID, there has been a lot of discussion about, how people with diabetes became more vulnerable, how people with other ailments became more vulnerable. And there's a new talk and discussion about the future of health, that perhaps we need to be more preventive driven actually in terms of moving ahead. How do you see actually the role of data or technology? Of course, policy is certainly out there, but what kind of framework you see in next 5-10 years for India, where the preventive medicine plays actually critical role in the larger, dialogue and debate and policy making on healthcare?
Well, Syed, no, what Sanjeev said is absolutely the way in which you do deliver healthcare to the population. But however, we need to recognize one of the fundamental challenge that we have in our country, yeah, and which we are getting resolved through this pandemic. Fundamentally, you need to remember, ours is not an integrated healthcare system, which many people don't understand. In most of the developed countries, a payer, provider, policymakers, playmakers, physicians, they're all linked to one central system where people know what is their accountability, what they are supposed to do, where is the technology assessment, there is a reimbursement happen to the technology, the standard of care is being discussed, and everybody knows who is going to get what. And the patient also know the kind of standard of care he will get. And there is a very clear-cut patient care pathway. Now, unfortunately, the way in which India has emerged, we followed a very different model where we allow, what I call it as a primary and tertiary and secondary care is at what I call the PHC, CHC, district headquarter hospital, general hospitals. Now, we will have a data from a government-centered hospital. Unfortunately or fortunately, since early 90s, private healthcare has significantly moved and started playing a very big role. But the unfortunate is that the data doesn't get anywhere. There's so much care has been done by private healthcare, but each of them are delivering, the data remains with them. Like what you just said, somebody is going for a hernia procedure and that person goes for a redo to another doctor. So the data is not there at all. And what devices somebody used, why it happens. So one of the silver lining that I'm seeing, I will take Maharashtra government as an example. I think the way in which they did this integration of the system, where I know that they captured the private hospital, government, all the data in one center. And they knew exactly how many beds are there, where, and what oxygen is required, what medicine is required, data central procurement. Now, this is a very big start for integration of a good healthcare system. Today, if you go to Maharashtra government, they will, as Dr. Subhash said, that they have a data and transparency comes in big time, right? Now, it's not no fault of others are not doing it. It's just that we need to encourage the integration of system for the benefit of the overall benefit of the country and to the patient. And then what Sanjeev talked about, all the analytics can be done. You can exactly know the load, which disease is having what problem. Like, for example, I was talking to the Cancer Society. Now, we have some good data available. Like, for example, J&K has a typical gastric cancer. Tamil Nadu will have more hepatic cancer. Like, each state has got a specific incidence of cancer. So you have a data. And you know very well how to respond to the data. And as a country, we will be able to respond to certain situation out there. So I'm a strong believer. I think this will help in even drug discovery. Amount of data that each, in fact, I sit on the Health Insurance Council, and they have so much of data, millions of insured people data available, how much they are reimbursing. But if you really look at the slice and dicing of the data, there is no healthcare people are doing the data, but they are doing it to underwrite the risk, right? From an actuarial perspective. But if you integrate payer, provider, physician, everybody has an access to a common data. Imagine the power of it. The data is the new oil. And as Sanjay said, that it's something that we need to push ahead and make sure, take the help of people like Dr. Subhash Salunke, who's definitely has done some great job in the integration of various players in the system. How did they do it? Because there are forces that will not allow it to happen. So my one suggestion is that, and the one which I wanted to leave the thought is, one of the biggest challenge that you will find in most of the admissions are related to pneumonia. Even I was looking at the insurance data, right? Most of the hospital admission finally end up in pneumonia. But today, we have a vaccine for pneumococcal vaccine, right? It's available right now at the door of India. I will encourage at least the vulnerable population to start looking at vaccinating and having the data in our apps, right? How many people have been vaccinated with the pneumococcal, which will prevent a further significant healthcare hazard related to various viral stuff that is going to happen now and also in the future. So this is something which I have enough data on that. I spoke to the companies like Pfizer, and brilliant stuff is happening in that area. As a preventive vaccine is something that we need to start looking at, and so that the intensity of incident that we had, the spikes, we could manage, because pandemic is something, management of spike is essential more than management of the virus itself, right? So this
Right.
is something, one big suggestion, I'll leave that here for takeaway. And of course, there are more details can be discussed at a much later stage.
Wonderful. Dr. Altaf wants to make a point. I also request our audience and participants, in case they have a question, they can drop that in the chat box. And my colleague Surbi will read those questions at the end of session in next 10 minutes. Yes, Dr. Altaf.
Thank you so much, Sayed. I just wanted to follow up. It's an important point that Subhash made, which is on the burden of pandemic at this time. We have a single-stranded virus that's causing this chaos, and they mutate. So it shouldn't shock us at any level, public health level, practitioners level. Certainly they need to inform the policymakers and political leaders. Mutations will emerge independently. The mutants will disperse. Mutants that are biologically fit will transmit faster, and exponentially the disease will grow. So therefore the need, while we reach and try to reach the 60, 70% till December of vaccine coverage, preventive controls have to go hand in hand. Mask wearing has to be there. Physical distancing has to be there. Hand washing has to be there. I just wanted your listeners to keep that in mind. Vaccine by itself at 60%, 70% coverage is not going to be absolutely the answer, because we also know that efficacy of vaccine and effectiveness of vaccine could be 70, 80, 85, 90%. There's always going to be these gaps and disparities then in which population is getting vaccine versus which population is not getting vaccine. Over.
Wonderful. I will come to you, Dr. Subhash, now actually with another question. I was thinking about, we having this discussion about technology, data, future. We can't ignore the fact that we are a still poor country. And there are millions and millions of people who just do not have access to basic health. I was just wondering, moving forward, looking at the future, what are the things we can do to address the huge gap of access to healthcare? And that's, again, the future. And again, I can see technology playing tremendous role out there. But Dr. Subhash, what do you think? Of course, you can make a point what Dr. Altaf was saying, but my next question to you will be essentially about how can we address the gap of access to healthcare to large section of the population, which really is actually living without any possibility of medical attention often.
Thank you. As a matter of fact, I just wanted to make a comment. We are a wonderful country. India is a wonderful country, and our health system is also wonderful because there are no legislations to govern it. That is the problem. And the issue that was brought out by Mr. Annaswamy, and that the no integration, there was a concept under the Public Health Act or a law, irrespective whether you are in the private sector, you are in the public sector, there will be compulsion on reporting information that is needed of the issues which are of public health importance. What they are, that is to be decided. However, in India, because health is a state subject, excepting 14 states, even the basic simple Clinical Establishment Act is also not promulgated. And that is one of the reasons why the data, both generation, collection, interpretation, analysis, and implementation is absolutely confused because there is no standardization. National level, I was chairing a committee of what is called the task force to develop a model public health act. We have done great work. 6 years it was with the help of the law school of Bangalore. It was worked out, and finally it is supposed to be in the ministry. 6 years. So if there would have been any act of public health making it compulsion on the all players, then I think things would have been better. I hope we'll see the light of the day. But now coming back to your question,
Yes, yeah.
coming back to your question, how do we meet the gaps? And I think that unfortunately the question which is lingering for last 70 years with our governments, and no government has been able to find the solution, even though on paper it is supposed to be there. If you look at our the structure with which the Indian health system has been designed, health services have been designed, right from the board committee to the most recent national health policy of 2017. If there would have been a seriousness on the part of government of India and the state government to implement that NHP 2017 in its entirety, which is addressing all the issues with the gaps, those who are likely to be, really what we have and not have, what kind of services and what level services need to be worked out, what human resources are needed, what drugs, diagnostics are needed. I can tell you, we know how to go about it, what needs to be done. The problem
Dr.
is about
Subhash,
implementation.
is there a way, or your suggestion for that matter, how can we improve collaboration across different stakeholders? Like, what is the one or two things we really need to do? Given India, health is a state subject, then every state is responsible, but then there's a national health government, a lot of other issues around. There are different ministries which govern, including in some areas is a flood and control department also comes into a covering health systems, the water ministry, the chemical ministry, the health ministry. Are there one or two things you suggest? And I will request, of course, Mr. Videsh as well, for your advice actually in terms of how to improve collaboration for a better future, for a better healthcare. Dr. Subhash, you first, and then Dr.
To put it in very simple terms, follow what we have learned in COVID. We have done that in COVID. Let's not forget, we are very peculiar system where we go on forgetting when the situation improves. That is the way we have behaved in last few outbreaks that we have come across. May it be SARS, may it be plague. So let us not forget that collaborative activity that we have been able to implement through the COVID, private sector, all health, not only health departments, interdepartmental collaboration, but other ministries. I can guarantee you, even if we retain 50% of what we are doing as far as COVID is concerned, I'm a very hopeful person, and I'm hoping that even if we retain 50% of the same principles, we'll be able to achieve that collaboration part. And again, let me complete that. Again, I wish to say that do not leave it to the discretion and individual, choices. Let it become part of the system, and that part of the system will only when the directives come. For example, in COVID, the directives were generated. Technical directives came from ICMR, Government of India, but a lot of things were developed at the state level. For example, in state of Maharashtra, we have put the capping as far as the diagnostic part is concerned, treatment part is concerned, standardization part is concerned for COVID. Why can't we follow the similar pattern after COVID for most of the public health problems? I mean, we can do that. We are doing it. So if we are going to forget this lesson, I think it will be most unfortunate.
Videsh, what will be your advice on how to improve collaboration for better healthcare and better decision making for the future?
No, I guess Dr. Subhash Alang has clearly mentioned, right? There's enough insight that he has got. See, I remember some years back, I was collaborating with World Bank, and we're trying to get a data for the country, right? It's a big project that we undertook. But let me tell you, considering healthcare is a state subject, now whether you like it or not, like as he said, Clinical Establishment Act, if you go through it, it's very comprehensive. It actually talks about data collection, it talks about integration and everything, right? So if you ask me anything, one thing that we may want to do it from here, can we promulgate Clinical Establishment Act as a first? That itself is going to solve many of your problems. Second, the collaboration, if you look at, I don't think deliberately people don't want to collaborate. There is no system by which people don't know what is in it for me, what is in it for you, how do I deal with that, right? It happens in my company that I ran. Collaboration doesn't something come naturally, right? So you need to set up an environment and a process. Leadership is definitely essential. As I call it, the leadership aspiration process and environment is so important. But the fact of the matter is that if you ask me, first, let's go through setting the system of Clinical Establishment Act. Second is that I think we need to recognize states who are showing a high level of collaboration, bring it to public knowledge. These are all the expected behavior, right? Because whether you like it or not, even healthcare system itself, unlike any other system, there are so many players, right? There are 7 to 8 players who create the play, right? Whether it's a payer, provider, policymakers, patient in the middle, physicians out there, laboratories, then you have pharmaceutical industry, diagnostic industry, medical devices, NGOs. There are so many of them, right? So this is not a something easily that we can prescribe that we need to do it, but I think we need to create awareness, right? I think we are not in China, right? China can do it very quickly, but India, we need to enroll and keep doing things like what Maharashtra and few other governments have done and set that up as a standard for others to follow. So I don't think I can give anything beyond that.
Wonderful, great. No, before we open up for a quick question round, actually, I will ask Dr. Altaf Lal. You know, the central of any system, it's also the machines are wonderful, data is great, but we need humans in the middle of healthcare. I'm talking about doctors in the middle of everything. In future, what will be your thing for how do you see the role changing for doctors as well? That maybe the academics, the way they study MBBS or MD with the new things coming in, how do you see that shaping actually the role of doctor in the future? You might guess.
Two-part answer to that.
Yeah.
I think within the Indian medical education system, community medicine has to be prioritized. What I understand at this time, individuals who go into community medicine go after they try the internal medicine, anesthesiology, et cetera, they don't get it, then they find spots in community medicine. That has to change. I started with NCDC when I started the embassy EIS program, Global Disease Detection Program. Those are the individual components that have to come in within the Ministry of Health, within the ICMR networks, so that individuals who are interested in community medicine find a pathway for success. There's a progression for them. There are Subhashiras as the role models. Yes, they can see themselves as leaders. Health systems is a community health systems narrative. Individuals, you and I, can be treated by finest doctors, but those finest doctors, you put them responsible for community health, chances are they'll miserably fail. Point number one. In the context of Maharashtra, I know you're winding down this part of the conversation. I would suggest that this panel, through Subhash Solanke, Subhash Hira is a common friend of Subhash and I. Government of Maharashtra starts a bold initiative. Zero COVID starts with me. Zero COVID starts with me. Whether that zero is accomplished in 6 months or 2 years, but there's a commitment.
Dr. Subhash, Dr. Altaf is giving you a proposal live, actually. Okay, yes, go ahead, Dr. Altaf.
Already, Honorable Chief Minister has made a statement. I mean, what Mr. Altaf Lal is indicating, the CM has already made a policy. माझे कुटुंब, माझी जबाबदारी, माझ्या कुटुंबात केस होऊ द्यायची नाही. माझ्या गावात केस, no corona, no COVID in my village, in my family. So that's wonderful. The policy already in one.
That's remarkable. Let them become infectious, throughout India, like
I
Prime
hope
Minister,
so. I hope so.
right? It may be health is a state subject, but state is part of a broader fabric also, right? What happens in Maharashtra, J&K has to learn. Orissa has to follow. UP has to follow. So you said in Marathi what I was saying in English, zero COVID starts with me. Congratulations.
Wonderful. Wonderful. I go to the final thought for Sanjeev again about doctors. What kind of manpower you're looking for a future to make sense of all this technology and data? It will certainly change a lot of things how medicine is practiced. Quickly, briefly, how do you see that the relationship of man and machine changing in the future of healthcare?
So we have a live example of this. We spent 3 years in a tribal district of Madhya Pradesh, Mandla.
Right.
The goal was to eliminate malaria. We eliminated indigenous transmission of malaria in under 3 years. A staff of 200 plus people were doing the work of about 1,200 people normally, if you would take into account how state would function.
Right.
Data was captured at the time data was collected. It was centralized. Through that data, supply chain of commodities was directed. We knew exactly where person A is on a given day.
Right.
We know where his supervisor was at that time. We
Right.
know where the supervisor was at that time. So I think it exists. Sanjeev will tell you it exists. The key is for
Sanjeev, how do you see briefly? How do you see the role of machine and man, the doctors and the machines? How do you see that happening in the future, next 5-10 years? Your microphone, Sanjeev. Sorry. Yeah, sorry. Your microphone, Sanjeev. Sanjeev, your microphone is off. Yeah, sorry.
So the doctors have to learn the technology a lot more than they use today. For example, the augmented reality. You could be remote somewhere, and through 5G network, you probably might be even able to perform a surgery. I mean, there are case studies that Google has showed, and it's possible. So augmented reality, interpreting the data correctly, getting used to the robotics automation, tele medication, video consulting. I think all of these have to become a norm. When COVID started, most of the IT companies went from work from office to work from home just like that. India is very well digitalized. There were a lot of countries across the world were very, very surprised that there was zero disruption when the COVID hit India in terms of IT services. It means Indian digitization is happening. There are internet that work faster in smaller towns compared to even metros. There are a lot of good companies have come in play from that perspective, using the technology not just as an option, but it has to become the mainstream. Because when you use the technology, when you adopt the technology, the scalability, the reach that we are talking about becomes very, very easy. Without the
yes, sorry. Go ahead. Sorry.
I think from that perspective, I see a lot more interaction that needs to happen between the doctor and the medicine and the technology. And then obviously, as the telemedicine centers that needs to be established, maybe most of the primary cares need to be retrofitted to adopt a lot of these new technologies. I think if you do that, I think then we will be able to, one, get the reach, and second, the scale.
Wonderful. We're almost on time. We have a couple of questions, and Sirbi can help me to read quickly then, and I request you to make brief comments. Yes, Sirbi.
Thank you so much, everyone. I think it's so motivating. We have a lot of questions for our panelists here, but I think we will take, if there are any repetitions, we will avoid them. But to begin with, our first question is the delivery of public health programs going to change post-COVID-19? Do we now need to deliver Asha Anganwadi services at home, at doorsteps?
Dr. Subhash, yes.
I think there will be changes. Definitely there will be changes. I will give an example. Our Honorable Health Minister's hometown is Jalna. I went with him to Jalna Civil Hospital and we were so worried because 35-40 cases in ICU and 2 MD medicine fellows, no intensivist. He was agitated, and so all of us, what do we do? Today, there are 2 more additions given, but they are being guided by the task force members who are great clinicians in Mumbai and Pune, and on literally every day, specified time, case management of each and every critical case is being guided by the people sitting in Mumbai, in Jaslok, in Pune, and things are much better in Jalna what they were 6-8 months back. So this is a concrete case what is happening in the field as such. Now coming to the actual delivery of the ASHA and Anganwadi services, I don't think there is going to be totally at the doorstep level, because let us appreciate it will be two-way. For example, there will be some delivery, some healthcare delivery provisions which can be done at the domestic level as per the needs, but basically the number is going to be restricted, the population is going to expand. Look at the infrastructural development in the country. We are working with the 2001 or 2011 population when we are in 2021. So human resources is going to be a challenge, and accordingly we'll have to do a combination of the two right up to peripheral level.
Thank you so much. Survi, second question quickly. I will come
Thank
to
you so much. So this is about data again. So it says, thanks for highlighting the value of data. Is there standards or mandates, policy at state or national level in reporting to centralized repository? How far this could be enforced in public and private sectors?
Dr. Altaf, you want to take that? Your microphone, sorry. Yeah, just brief comment. I will just add one or more questions then.
Yeah, I may not be the right person because I don't follow at depth the systems in India. So perhaps Jeev could.
Sanjeev, maybe perhaps you take that one.
I think from the IT perspective, I can definitely talk. There are standard APIs that are available that can potentially plug into every healthcare systems and ERP systems that could then potentially be connected to a standard analytics softwares. Right, so it's the system wise, the technology and the ERP softwares are available. I think now with the government standards, the policy guidelines are there in place for the hospitals to report upwards. I think I'm not qualified to comment on that.
Videsh, you want to chip in and share a thought?
Yeah, but yeah, it's not as easy as it's, I don't think I'll be competent to respond on that because it's a very complex subject and he has made a very important point.
Okay, wonderful. So we go ahead with the third one.
All right, so there are a lot of questions on actually telemedicine.
Yeah, we'll take two only, Survi, now. We are just...
Okay. So let's take telemedicine, and this will cover possibly 4-5 questions, covering that. So this says there have been a lot of talks about telemedicine. What potential do you see in telemedicine for India in the future?
Okay, any one of you go ahead. Yeah, Dr.
Yeah, I think there is a great potential. In one word, there is a great potential. I can assure you, for example, let's take a concrete case. In third wave, we are anticipating that there will be more pediatric or younger age group cases. That's what the contemplation is. And accordingly, we are preparing. Now, there is one school, there is a task force separately working on. There is one school of thought which says that, we have a highly trained pediatrician right from the community health center level, which is out of question. There won't be so many. My suggestion in the last meeting with the Honorable Chief Minister and the Chief Minister was very simple. I said, sir, we have private pediatricians, we have government pediatricians, they are located in the urban areas, which are at the district and sub-district, not below that particular level. So let us have a centers which are much better to take critical care of pediatric cases, and it will be referred from the most peripheral level through the appropriate ambulances, rather than trying to look for highly trained neonatologists, pediatricians to be located at the sub-center. We are not going to achieve that because nobody is going to stay there if I am a neonatologist. So the idea is prepare the centers who are going to deliver critical care at the peripheral level. But these guys will be able to guide the doctors in the primary health centers, in the community health centers, how to refer, how to manage primarily through the telemedicine. So telemedicine or telemedicine's versions. And telemedicine could be just a very basic one. There are going to be further versions, which is going to be essential. And I think without technology, without data, if any health services of any state is going to be implemented that will be a most retrograde state. Every health minister and health minister of this India now, who has taken over recently yesterday, my appeal to him and request to him going to be, please, you have great challenge, and one of the challenges, you are not going to be able to achieve that HR in short period, but you will be able to achieve the use of technology so as to equip the capacity of the people who are already there.
You know, that's so wonderfully put. I think if I request all of you in a one word or one brief sentence, what is the one thing you want to recommend to the health minister in Maharashtra or to the other ministers across the country? What should be the one thing they should put a topmost priority in the next 5-6 months, particularly dealing with the COVID-19? Altaf, I can go ahead with you, and then I will come to the Videsh after that.
Thank you so much. I think that's a very valid and appropriate question. I'll have a recommendation for the health minister, the union health minister, and a recommendation and an ask for the health minister of the government of Maharashtra. Government of Maharashtra first, focus, focus, focus. And since health is a state subject, the responsibility is at state level, but certain structures at national level devise strategies, devise policies. My recommendation would be create systems that you feed in real time. Like Subhash mentioned, what is that state of Maharashtra would like to see? For instance, emergency use authorization.
Let's brief, yeah, very brief. Yeah, sorry.
Emergency from Maharashtra to Delhi. Emergency use authorization has worked phenomenally in India and elsewhere. Why can't we use versions of EUA for other medicines that need to go through approval system?
Videsh, let me come to you. What do you?
Last piece. Yes. The Drug Control General of India is a phenomenal institution. Elevate that to a Government of India secretary level position, very similar to DBT, ICMR, and CSIR. If you do that, the processes, functionalities will improve significantly. Health of India will improve significantly.
Wonderful. Videsh, what do you think should be the topmost priority for our ministers in the next 5-6 months, given the COVID is still out there?
So I think a very simple suggestion I have. As you know, pneumococcal vaccine is currently in the schedule of pediatric patients. It's part of the Indian government for rotavirus as well as a pneumococcal vaccine. Let's accelerate this for pediatric patients. Already there, stocks are available. Children need to get vaccinated. Number one. Second, now it's approved for people above 18 plus. I saw the approval from Director DCGI, and obviously the approval is for 60 plus. Frankly, in my opinion, based on all the data that we are seeing, please start looking at PCV, pneumococcal vaccine, as an auxiliary vaccine, which can prevent a serious impact on whenever a COVID hits. At the end of the day, it's all about pneumonia. It's all about lungs. So for me, the one suggestion, if I'll give, the government should seriously consider that, accelerating beyond pediatrics and go to the adults.
Wonderful. Mr. Sanjeev, what do you think is a one recommendation from your side?
I think we need to achieve patient care anywhere, anytime. That's possible only through technology adoption and harnessing the data. So I think that should be the focus for the health ministers, both at Maharashtra as well as central level.
Thank you so much. Dr. Subhash, we were really keen to have a minister here, and he was very keen to come over for this summit. He couldn't make it. We can completely understand that. What are you going to tell him after this dialogue here when you meet him next?
Sure. I will certainly put everything what has been discussed in a nutshell and clearly indicate to him that there are avenues available for Maharashtra. There are private sectors, including companies like you, are available for us to take the strength of the data analysis, everything related to data, and use this to improve the quality of whatever the data that is being collected in the state. And two, it is not only collection, compilation, and analysis, but its implementation and feedback. That entire circle, if it is established right at the block level, like I used to say that every multi-purpose worker must know why I am collecting this information data, how am I going to make use of it? if we can really achieve.
Thank you so
that,
much. That's so wonderful. Thank you so much. I think, this is it. And thank you so much, Dr. Subhash, Dr. Altaf Lal, Videsh, and Sanjeev for joining us. It was really insightful conversation. We have a lot of people who joined us on social media platforms as well. We are going to share this video with all our, viewers and, readers. And we really look forward to keep this conversation going. We will be having, same discussion with other thought leaders in different parts of the country. And we're certainly looking forward for a better solutions, better interventions. And that will only happen when we keep talking, when we keep collaborating. So on behalf of my whole team here, thank you so much for joining. And I request, Ruby, that it's over to you again. Thanks a lot. Thank you so much, everyone.
Thank you so much. Thank you to all our speakers present here. I think let's now give a chance to all our participants. And there is a very small poll that we want to conduct. It's just going to take 5 minutes. So it's for our participants. In fact, our panelists, our speakers can also poll. I would request Shivali if she can open the poll. There are just this quick 6 questions that you need. You can see it on your screen right here. And let's see what our participants have to say. Yes, here we go. 5 minutes.
Yes, everyone, please do join in, actually. This will really help us in moving forward. Better medical research for sure, yeah. Data certainly is, and then more money actually into healthcare. Very interesting.
Increased public expenditure on healthcare.
Can I be excused, please?
Sure,
Yes, sir.
sir.
Yes,
Thank you so much. We really appreciate the time that you've taken out today with us.
Thanks a lot.
Thank you, everyone, then. Thanks a lot. Thank you so much again. Thanks a lot.
All right, so here the poll is over and we've got the results. And thank you so much, everybody who participated in the poll. With that, we will move on to our next session for the day. And for that, I would invite my colleague, Jisha Krishnan, who's the editor of First Check, which is a flagship project of Data Leads in Health Analytics Asia, to moderate the next session for today. Over to you, Jisha, with that. Thank you.
Hello, I'm Jisha Krishnan, editor of First Check. First Check is Health Analytics Asia's flagship award-winning fact-checking initiative that endeavors to fight medical misinformation. As a health journalist for over 17 years now, I'm acutely aware of the yawning gaps and many challenges that India's healthcare system has been burdened with. And this was much before the COVID-19 pandemic toppled healthcare systems across the globe like dominoes. You cannot solve a problem on the same level that it was created. Albert Einstein had said, "You need to rise above." Today, for the Maiden Summit of the Health of India series, it gives me immense pleasure to introduce you all to 5 such health trailblazers who rose above, found innovative solutions to address the many challenges that India's healthcare system is facing. Though each of them come from diverse backgrounds and have unique stories to share, They all have certain qualities in common: the courage to challenge the status quo, the ability to take calculated risks, the zest to explore new avenues, and set the stage for the future of India's health. Without taking any more of your time, let me introduce you to the first speaker for today's Flash Talk session, Dr. Geeta Manjunath, the founder and CEO of Niramai Health Analytics. The company has developed a breakthrough machine learning solution for detecting early stage breast cancer in a non invasive, radiation free manner. She has 16 US patents to her credit and more pending grant. Ladies and gentlemen, please join me in welcoming Dr. Geeta Manjunath.
Hi, I'm Geeta, CEO and founder of Niramai Health Analytics, where we are developing a new method of detecting breast cancer using machine learning on thermal images. Machine learning is a part of artificial intelligence where database decision making can be done using mathematical models, probability theory, statistics, and like. Simply speaking, it is computer making decisions just like human beings. So it can be trained to learn about certain decisions that humans do well. And then using huge compute power and intelligent algorithms, it can actually sort of start mimicking some of the decisions that humans make. And particularly in healthcare, this is very, very important because there's huge amounts of data in healthcare. It could be medical images like our chest X-rays or ultrasound data, or just the temperature data that's coming in, or in an ICU, there's monitoring kits around. So all of the data, can that be used to make better health possible for the end user? That's where machine learning can make a huge difference. And this, when coupled with intelligent devices that are coming in, different type of sensors that are being released in the world today, can be a huge boon to our rural healthcare. I believe that in India, just like digital divide, there is a healthcare divide, right? We all know that number of doctors compared to the number of patients that are needed is hugely there's a disparity. Very few doctors and a large number of patients in India. Particularly in villages, one doctor is serving thousands of families. So in this case, if a machine learning based healthcare bot can make some decisions, quick decisions to enable people to get quality healthcare at the right time, it is the best thing that can happen. We have seen how COVID has affected rural healthcare and taken away so many lives just because they could not reach a hospital on time. And this can be alleviated using machine learning, because simple triaging decisions of who needs the care immediately can be made with automated decision making. The same machine learning model in a city, for example, can also be helpful to the doctors. Each doctor, for example, each radiologist is serving lakhs of patients. So it's huge workload of patients that the doctor has to bear. And here, once again, the tool can come in, help prioritize patients who need quick attention for the next set of tests or treatment, or even things like, by mistake, if a doctor misses a cancer in a chest X-ray or cancer in breast, the tool can sort of do a thorough check and say, maybe you missed it, why don't you check it, right? Can be a second reader, just a helping tool for the doctor as well. It can also analyze a lot of data and within minutes provide this summary that the doctor can review and make decisions much faster. So it can be a friend to the doctor and an extended arm to the doctor in rural areas. So I believe machine learning in healthcare has a huge potential to bridge the gap between rural healthcare as well as the urban facility that we have, and enable quality healthcare, affordable and accessible way to everyone in India per se. Particularly talking about Niramai, at Niramai, we have developed a new method of detecting breast cancer using machine learning. So we just measure temperature variations on the chest, and we have developed an AI-based analysis which automatically can analyze these temperature variations and say if the person has breast cancer. If so, where is it likely to be? Or is it just an abnormality, or what is the probability that the tool thinks that it is cancer itself? And all this can be done within 15 minutes and can be done by a health worker. In a village, it automatically generates a triage report, a red, yellow, green, traffic light output. A red means bring her to the hospital. Green means she can just wait for the next screening, she's fine, right? And the same thing can also be used as a diagnostic tool in a hospital where we generate a complete report automatically and provide additional information, quantitative scoring that will help the doctor decide what kind of next action needs to be taken. And this is very unique because it's completely radiation free. We do not use X-rays. We just measure temperature, absolutely safe. It does work on women of all age groups, 18 to 80 years. And it's completely affordable, much, much more affordable than the existing methods, 1/10, 1/20th, the cost of existing methods, can be done by simple health workers, saves a lot of time for the doctor as well. And most importantly, it is completely privacy aware. Nobody sees or touches the person during the test. No see, no touch, no pain, no radiation. We hope solutions such as these can enable so many diseases which are getting detected late, and we're losing so many people for diseases such as cancer, which only when detected early would have high efficacy. So in future, I actually see how machine learning can aid a doctor, bridge the gap between rural and urban healthcare, and enable affordable, accessible healthcare for everyone, and enable early detection of diseases such as cancer, health diseases, and so many non-communicable diseases, and then save many, many lives.
Thank you, Dr. Geeta, for that insightful talk. Indeed, if more people looked at technology as an ally rather than a foe, then the future of Indian healthcare will certainly be brighter. At Health Analytics Asia, we believe in the power of research to help better navigate these uncertain times as well as shape the future of the healthcare narrative. As one of the oldest medical research institutions in the world, the Indian Council of Medical Research, ICMR, plays a key role in addressing the challenges and finding innovative solutions to India's many healthcare problems. I take this opportunity to welcome Dr. Rajnikant Srivastava, Head of Department of Research Management, Policy Planning and Communication in Delhi, and Director of Regional Medical Research Center, Gorakhpur, as our next speaker for the session.
Thank you so much for this opportunity. Actually, you are asking me about the ICMR role in building India's medical research capacity. So I would like to emphasize that ICMR is one of the oldest research organization in the country. It was set up in the year 1911, before Delhi became the capital of India. ICMR was set up with the name Indian Research Fund Association. And now ICMR is the apex body in the country for the planning, promotion, coordination, and implementation of health research under the Ministry of Health and Family Welfare. So now we have completed more than 110 years. So we are working since last 110 years, and our health research priorities are aligned with the national priorities and the need of the country. ICMR is having a network of 27 research institutes across the country. They are working in different disease-specific areas. For example, we have institute in the malaria research, we have institute in the tuberculosis research, we have institute in the leprosy, HIV/AIDS, nutrition, occupational health. So we have a network of 27 institutes, and we are working together and how we can address the health issues of the country. As you have mentioned that COVID-19 has been a serious problem, and since 2 years back, we never knew about the COVID-19. And ICMR has played a critical role, important role, so far as the COVID-19 is concerned. And before COVID, you might be aware there was a problem of Nipah, Zika, dengue, chikungunya, And ICMR was instrumental in tackling the outbreak and epidemics, whether it was the Nipah outbreak, whether it was a Zika outbreak. And during the H1N1, that helped in creating a network of laboratories across the country. And we were able to set up a BSL-4 laboratory in Pune. And because of these existing laboratories, we were able to do research when the COVID struck India. And during last 1.5 years, if you go back last year in 2020, January 2020, there was only single laboratory that was National Institute of Virology, Pune, NIV Pune. And that was a single laboratory. They were able to do testing for the COVID-19. And today, as of now, I am talking today on 5th of July, 2021, we have a network of around 2,700 laboratories across the country. So far as the testing is concerned for the COVID-19, that is not a big issue for the COVID-19. Besides the COVID-19 testing, ICMR has also played a critical role in the development of the COVID diagnostics, such as COVID Kavach ELISA. ICMR was also instrumental in isolating the virus, characterizing it, and having a partnership with the Bharat Biotech. And that was fruitful in developing the vaccine, that is a Covaxin, the first indigenous vaccine, and that has been rolled out in January 2019. So that is all about the ICMR. Besides the COVID vaccine and the COVID diagnostics, ICMR was also doing the validation of the kits and the reagents. For example, RT-PCR, ICMR validated, evaluated around 360 RT-PCR kit, then antigen 114, then home test 3, and rapid antibody test 209, RNA extraction 275, VTM 259, and ELISA 107. So ICMR was supporting the private partners and the industries so that all these reagents, kits, and the diagnostics, they should be available in the country. That is how the role of ICMR was very important so far as the COVID-19 is concerned. Besides this testing, ICMR was also crucial in doing the sero survey. For example, in June last year, ICMR did the first sero survey, and at that time, the prevalence was only 0.7%. Then ICMR did the second sero survey in the month of August and September. At that time, the sero prevalence was around 7%. Then ICMR did the third sero survey that happened in the month of December and January. At that time, the sero prevalence was around 21%. And ICMR clearly indicated that currently even 79% of the people, they are still susceptible and they can get exposure to the COVID-19. And that resulted in the second peak of the COVID-19 because the 79% of the population, they were totally susceptible, only 21% having the zero prevalence. And now recently ICMR has initiated the fourth zero survey. It is in the process and very soon we will be able to publish the results of the fourth zero survey that is happening around in around 70 districts of the 21 states. That will be completed in July and results will be available soon. So besides this COVID-19, because since last 1.5 years, ICMR was on the forefront in dealing with the COVID-19 and providing the support to the government of India to combat and to tackle the COVID-19. But besides the COVID-19, ICMR has also playing important role in various other health research areas. For example, we are now targeting the NTB by 2025. ICMR has recently set up in India National Tuberculosis Consortium, that is ITRC. And we have started the National TB Prevalence Survey across the country. After 60 years, that will give you a burden of tuberculosis in the country, and that will help how we can eliminate TB by 2025. Similarly, ICMR has also launched a program that is a MERA India, Malaria Elimination Research Alliance, because the target of malaria elimination is 2030. So that is a platform where the many stakeholders, national, international, private partners, NGOs, they can sit together and they can discuss about the future programs and plans, how we can fast track the malaria elimination. ICMR is also working on the lymphatic filariasis, in the Kala Ajar, and non-communicable disease, because while we are talking about the communicable disease, the non-communicable disease like the hypertension is a serious problem. Cardiovascular disease is again a serious problem. Cancers are rising regularly. So ICMR is having a national cancer registry program that is also running and providing the burden of cancer across the country. Recently, we have initiated a India Hypertension Management Initiative, IHMI. So we are doing a survey across the country that will let us know how much is the burden of hypertension in the country. So that kind of research is ICMR doing. We are having a robust capacity building program. We are having a GRF, SRF, STS, postdoctors. So young generation, they can also get exposure to the health research and they can pursue their career in the area of health research. So we have having a robust program in the capacity building and human resource development. So that is how ICMR is working. And regularly, many of the research programs, they are being translated for the inclusion in the government policy. And we are always aligned. Many of the ICMR institute, we are having a regional institute, regional medical research center working in the Port Blair, Andaman and Nicobar, in Bhubaneswar, in Gorakhpur. For example, in Gorakhpur, we are working to tackle the JE and AES. That was a serious problem. In Andaman and Nicobar, leptospirosis was a serious problem. So our institute in Andaman and Nicobar, they are doing good quality research in the area of leptospirosis. Similarly, we have an institute in Dibrugarh, Regional Medical Research Center in Dibrugarh. So they are working on the regional health issues. For example, paragonomiasis is the problem in the Dibrugarh area. So they are focusing on the problems of the northeastern area. For example, paragonomiasis, malaria, tribal health issues. So ICMR institutes, they are working as per the requirement, as per the need of that region. For example, in Desert Medicine Research Center, that is now renamed as the Center for the Non-Communicable Disease Implementation Research, they are working in the area of local health issues. So many of the ICMR institute, either they are working for the national health cause or for the regional health issues. That is how the overall ICMR works.
Thank you, Dr. Rajnikant, for reiterating the significance of investing in health research and learning from past epidemics in order to emerge stronger from the current scenario. Healthcare, like all other industries, needs to brace itself for the next normal. Apart from cutting-edge technology and sound research, what else will it take for healthcare in India to reimagine the future? To answer that question, we have a renowned public policy and health systems expert as our next speaker, Dr. Chandrakant Laharia. Welcome to Health of India eSummit Series.
Thank you very much for the kind invitation. I think in today's time, health equity is a very important consideration. We need to remember that when we talk about health equity, it is about absence of any unfair, avoidable, or preventable difference in health among the population groups. Always know that in health, inequities have always been there. Kings and the royalty always had a higher and better health outcomes, lived longer than the commoners. But then the time had changed. Now we need to have equal health conditions for everyone. So even 100 years ago or 200 years ago, the pandemic of cholera and great influenza of 1918, 1920, the poorer and the people who were lower on the social hierarchy died at higher rate. They were more infected. But in 2021, we expect little better, that the health outcomes of individuals should not be dependent upon their socioeconomic status or any other equity stratifier. Way back in 1971, Julian Tudor Hart gave a very important concept, the inverse care law. He said that the availability of health services is inversely proportionate to the needs of the people, which essentially means the poorer, lower in the social hierarchy have less access to healthcare than the rich who had a better access to health services. So in today's time, we always need to focus, and we should focus upon health inequities. What are the commonly linked determinants of health equity? Often the place of residence, the rural, urban, tribal, or any other setup determines the level of health of citizen. Race and ethnicity is also important consideration. Occupation of people, workers or employed or unemployed, the gender, male, female, transgender, all of those decide the health outcomes. Religion, the education, the poorly educated or higher educated have better access. The socioeconomic status, social capital and resources, there are many stratifiers which determines the health status of population, which they should not. Thankfully, the global community has started talking about universal health coverage, which essentially say that all individuals and communities, irrespective of where they are living, what they do, should have access to quality healthcare services without financial hardship. So essentially, the global target of universal health coverage is focused upon achieving equity, that no one should be left behind. Everybody should have equal access to healthcare services. All population, all services, and for everyone should be affordable. We need to remember that when we are designing healthcare services, the focus has to be on most marginalized. We need to think of, let's say, a vegetable vendor in an urban setup, whether he has a similar access to healthcare services as somebody who is working class. We need to think of a tribal population or tribal family, whether they have similar access as any other living in the same state in an urban setup. We need to think of underserved migrant person in an urban slum, whether he has that kind of access or not. So one of the way to ensure that health inequalities are or health inequities are addressed, that we need to have a granular, good quality data. Now, for health equity, the data can come from national surveys or administrative reporting, official reporting surveys, and special surveys can be conducted. But key thing, if we want to achieve health equity, is that we have a granular data on the determinants which we discuss and things which we think that could be cause of inequity. Now, coming to the ongoing COVID-19 pandemic, we know that there are so much of impact on the poor, vulnerable, marginalized in this pandemic that Oxfam, the Oxfam International has called this virus as the inequality virus, because it has inequally affected the marginalized downtrodden. We are seeing an ongoing and live example of inequity in the vaccine availability and distribution. The rich have a better access to vaccine than the not so rich. The urban setups have a better access due to more availability or higher number of centers and private facilities than people living in rural area. So inequities are pervading all across, and they become really big challenge, and they are everywhere. COVID has reminded us that COVID-19 pandemic, that there is access to health services, access to vaccines between the countries and within countries are really big challenge. So possible solution of tackling all these inequities is that we recognize recognize the need for and strengthen health equity monitoring. And to do that, we need to collect the timely data. We also need to look at the data from various stratified, rural, urban, male, female, poor, rich, working class, not working class, slum dwellers, or middle class families. So equity stratified data in multiple layers collected in a timely manner through the surveys, through administrative reporting, or every possible mechanism, and then analyzed by experts in the timely manner to inform policy making. That's how we can achieve equity. I think world has learned a lot in last few decades. We need to put that knowledge into practice. And the start can be with many of the ongoing intervention in COVID-19. And the world should focus upon the equity, especially in the vaccine delivery and availability. And I think that will be a great start. Thank you very much.
Thank you so much, Dr. Chandrakant Lere. That was so really nice of you. And before we move any further, we want to take this opportunity to welcome Dr. Naresh Trehan. Dr. Trehan was actually, he was a part of the panel in the beginning, but because of a hard-pressed commitment, he could not join us on the panel. But that is really, really nice of you, Dr. Trehan, to have joining us for this special series today and to share your thoughts. Thank you so much once again. With that, it's over to
you. Sorry,
first
my apologies. I called in by the health minister, the new health minister. So there was no choice for me from that.
Of course, we understand.
I appreciate the invitation to speak here. And I did have the opportunity of listening to the last part of Chandrakantji's delivery. Of course, he's a very learned man. And I don't think that anybody on this panel or anybody in their right mind would disagree that there should be equitable healthcare available to everybody. There are many things written, and we've been struggling with it. And if just as a reminder, there is no country in the world which has been able to master this animal. And least of all, India, where the population is totally out of control. So if we can really come up with a working model, I'm on the ground, so I'm a surgeon. I face all this, And I'm also on the task force for the Supreme Court on the National Task Force. So I got some insight into the thinking and the challenges and things like that. So obviously it's a very daunting task. If you take countries like America who can't deliver after spending $15 trillion on healthcare and still not getting anywhere near where we should be, or you take the UK where NHS is a good service but very wanting in many, many things. So this has been a very difficult intellectually a very important factor, but a very difficult to surmount this whole problem. So what I'm trying to say is that rather than giving a demand side from us, we should look at the delivery side of it. How can we accomplish it? If we have granular data is very important, but we go down to granular solutions also. So just if the problem is that not all of us are actually working together to say, yes, we have a challenge on our hands. How can we actually overcome it? Now, money is one problem because everything that you do costs money. That's not is a country like India where we've always said that not enough is being given for healthcare. But the government seems to be responding now to say yes, and pandemic has actually brought it very close to the nose that we have a problem and we better take care of it. But there are multiple factors to it. Multiple factors be environmental. I mean, if you hear the delivery of the New York Times writer Tom Friedman, who wrote Earth is Flat, he said this is a war. This is a war between Mother Nature and Father Greed. That the human greed has destroyed everything around ourselves. How much of anything is enough? How much do we want to? So unless we as a population of the world start respecting the earth, that is one part which will otherwise this opportunistic kind of infective organisms, whether it is virus or bacteria or fungus or whatever, they will always be there. They're part of the ecosystem. We have disturbed it. We have ripped it apart. So this is just the beginning. And if we don't correct course today, then there will be hell to pay 10, 20 years from now. So I think that if we can, it's very interesting that we have panel after panel where we have talking heads, including me, which doesn't go anywhere. So my frustration with life is that, okay, we spend a lot of time talking about it. I have some little knowledge because I'm a surgeon. There are many, many doyens of knowledge on this panel. But we need to also go beyond that. You say, if we say something, you commit yourself to it. If you're saying it at a panel to say this should happen, that should happen, just do it. Don't say this should happen. We all know what should happen. So I'm saying that in future, Sayedji, when you put together panels, they say that in the half an hour afterwards, there'll be a working solution part of that panel. So you say, okay, what are you signing up? If I said something, I should be signing up for it. I shouldn't be then say, oh yeah, I gave some lofty proposal to everybody, and then I'm comfortable. What do I care? That's not how it should be. That means that if we believe, we should get on the ground and start doing it. So right now, like one of the things is controlling the cost of healthcare. Then, and as a first thing, we need to establish what is the cost of delivery of one unit of healthcare. So you unitize the whole thing. Once we know that a nationally or internationally accepted norms of how to establish the unit price, so there are many people who put many things out of the hat, and there are different interests. So we need to converge them into a realistic costing. Once we have the realistic costing, then we should say, okay, this is what is allowed. Like today, we demanded, I'm one of the first one to demand that do not allow private sector to charge what they want for delivery of vaccine. And in the first few weeks, we saw lots of people taking lots of profit, which was not required. And the government responded to our demand to say, please fix the price so that nobody, it should be universal. It should not be opaque. It should be transparent. So that was done. So we know now, everybody knows that you're not going to make any money. If anything, you're going to lose some money on vaccination. And the other thing I would like to inform Chandrakantji is that I don't think that there is inequity in distribution of the vaccine, because we are on the ground. We are all, everybody. So I see. But the problem is that on the ground, there's a lot of hesitancy. There is much more hesitancy in the rural area than in the urban areas. And right now we are experiencing that when we are going to villages, we're all participating in that there is vaccine that we carry as a registration. Those 30-40% don't turn up after registering. And this is everybody's experience. So I think if we can actually do everything we can to dispel fears of vaccine, that will be a service today. That will be the service to say, we do not have, the data is very clear. We do not have any major adverse effects. We do not have any side effects with this whole thing of bugaboo of clotting and all that. I mean, even if you believe it, there's nothing to believe, because it's 4 per million. And that is the normal stroke rate anyway, or even it's lower actually than what normal is. And we can always say, okay, everybody take aspirin for the next 3 weeks, small baby aspirin. So there are solutions. Sorry if I'm going away from your...
No, absolutely. I think these are wonderful thoughts. I think this was almost the discussion we had early in the plenary. I think all of them eventually agreed that, we need to start from somewhere. We can't just hope the future will be there. We need to create it. We need to work together at different levels.
So you can count me in that.
I think you really underlined that fact again.
Any productive activity, I'm a volunteer. Thank you so much.
Thank you so much for joining, and really I appreciate that you came back and again shared your thoughts, because what we've been almost in a concluding phase. It's really important for us, to be honest, to have the best minds together. And what happens that often we're having a lot of bad situations because best men or women decide to take a backseat. They allow others to come forward in a lot of discussions and policy interventions. But I think it's also very important for our policymakers eventually to take these thoughts together. And we discussed with Dr. Subhash, who was joining, his advisor to the Maharashtra Chief Minister. He was in the panel, and we requested him at the end of the panel, can he take this discussion directly to the minister when he's meeting him in the afternoon, and whether these recommendations will find some place on the ground. So I would request you then, Dr. Trehan, as well. What will be I know you're there. You have an insight what's happening at the national level, but particularly with Maharashtra, they were really badly hit in the second wave as well. What will be your recommendation, for a state like Mumbai, for a state like Maharashtra, in the next 5, 7, 8 months? How they need to be more careful so that we are better dealing with the future, immediate future.
By the way, having taken a sort of a deeper peek into Maharashtra's handling of the COVID, this whole onslaught that came, and the systems they put in place, and we have one of the 2 people from Maharashtra who are part of the NTF. So we exchange information. I've heard the models and all that. I don't think you can teach much to Maharashtra. Maharashtra has done extremely well. And the only thing is that we all know what the universal fact is. There are 3 factors which shall actually decide when and how high the third wave is going to be. So one, of course, is what we are talking about is public behavior and decreasing vaccine hesitancy. If we can whoever has any say anywhere, even if it's your own employees in your household or whatever, we should be always on the one words coming out of mouth is that vaccine is safe and it is essential to protect yourself, your family, and the country. So if somebody can understand that, that is one. 2, very soon there will be enough vaccine available and we have the capacity. And I'll give you a data. So there is a modulation done by somebody very knowledgeable called Shakti. Shakti has got that if we can vaccinate starting July, 50 lakh people a day, we can flatten the wave or reduce the wave by 25+%. If we can vaccinate 70 lakhs plus people a year, or a day, sorry, we will be able to reduce the wave by more than 50%. Excuse me. And if we can go to 90 lakhs, we will flatten the wave. So, and it stands to logic, except that you don't know what the virus is going to do. That's the unknown. That is it going to come up with another variant which will cause more devastation in this world? We don't know that. So this is a war. But in this war, the first thing we know is that no matter what variant is around, vaccines do give great protection. So that is one. Two, excuse me. The third is government's determination to not let it spread. So firm action, quick action, wherever you see a fire, contain it. No matter what you have to do, because that will be temporary. If we can stop a wave by locking down the whole country in 2 months, doesn't matter. It will be much less lost than if it goes on for 6-8 months and devastates so many people. So it's only the administration that can be sensitized that real-time information is coming, and you know where the hotspots are. You know, today, I give you an example. The entire airspace of the world, not India, of the whole world is managed from one center in Oslo. Every plane that is in the sky, and there are lakhs and lakhs of them in the sky, they are being mapped by this sophisticated IT system, which tells them exactly who, where, if they're coming too near each other, is there a collision cause, what is there, are they maintaining the right elevation, all that stuff. So if we can reach that stage, and it didn't happen today, it's been happening for many years, of course it's being improved every day, but we can have, and this is what we have recommended to from the Supreme Court Committee to the government, that you must have a COVID war room which brings in information real time, so that you can guide the state governments, the district authorities, the block level people, that look, that's the hotspot right there, and please contain it. There is a very interesting example of Bhilwara district in Rajasthan, that one DC of the area decided that there are too many cases here, I will fight it myself. He actually encircled the whole block and locked down the district. COVID has not seen more than 5, 10, 15, 20 cases a day, ever, because of the fact that this was one decisive person who did this maneuver. So as a country, if we do it, yes, we can go back to real life, hopefully by January.
I think thank you so much for these wonderful thoughts. I know I eventually take your point on data, and that also makes me very glad. Actually, we're launching a data hub today at the end of the summit today. But Dr. Trehan, we will keep this conversation going, and we're having the next round in Delhi, and we look forward to have you again for your insightful the discussion and advice on moving forward in India with the future of healthcare.
Thank you. Thank you so much.
Thank you so much, sir. Thanks a lot. Thank you so much.
Thank you so much.
Thanks a lot. Thank you so much.
Wonderful. That was so really nice of Dr. Trehan to have joined us. I know it's really, really heart pressing for him. And like you said, that the minister had called an urgent meeting in the morning, but we really appreciate that he took out time. So moving back to our speakers of the Flash Talk session, I think we will go back to
the next speakers or viewers. I think Anuja, our colleague Anuja.
Yes,
right?
yeah, and Anuja has a lot to say about it. So let's go back to what our speaker has to say. Yes, please. Thanks.
Thank you, Dr. Chandrika. That was truly thought-provoking. Just like your brilliant book, Till We Win, India's Fight Against the COVID-19 Pandemic. As we look to recover from this pandemic, it's important to seize every opportunity for innovation and growth. Our next speaker, Mr. Suyog Joshi, the Chief Product Officer at NIBI, an industrial analytics company, will shed light on the role of technology in providing actionable insights to help businesses plan for the future. Welcome to the Health of India e-Summit series, Mr. Suryok.
Hello everyone. All of us are going through the pandemic, which has not happened in centuries. Everything is shaken, which is of our life, be it our day-to-day commute, day-to-day lives, eating habits, etc. And the most important thing which has come to limelight in this whole scenario is healthcare sector. The importance of healthcare sector, even though it was always acknowledged, but the kind of prominence it has got in this particular pandemic is unparalleled. And as they say, few things change for forever and for good. So I guess now this is going to be the time when things are going to change for the whole world as far as the healthcare sector is concerned. Now, coming to healthcare, what are we talking about? We are talking about changes in the infrastructure. The very important change which we are going to see in next few days is the focus on the APIs. Basically, creation of APIs within India with Atmanirbhar Bharat taking a front stage. Basically, the API formulation in India is going to increase. We are talking about the key ingredients which are needed for vaccines. Lot of things are actually going to happen in the days to come. Now, a lot of people keep on talking about the economic stimulus, which is the need of the hour as far as our economy is concerned. Of course, it is. But I read a very interesting view in terms of stimulus. If we are able to give a very significant amount of stimulus to healthcare itself, essentially that is going to go a long way as far as the economical revival is concerned. In fact, Honorable Finance Minister in her last budget already has allocated certain percentage of GDP to the healthcare sector. And she's saying that over the next 5 years, it is actually going to grow exponentially. And I believe it is going to grow even further. It is just not going to be restricted only to 5 years. It will go further. So now coming to how manufacturing companies, healthcare companies would be spending that money, or where that money is going to get invested, be driven by stimulus as well as driven by the demand. So there are two aspects we talk about, right? First is the capex investment, starting of new plants, starting of new lines, extension of additional capability in terms of production, especially the pharma companies. And the second option is going to be optimization of the current existing capacity. Because we have enough, in fact, India is already known as the biggest exporter of vaccines in the world, or vaccine manufacturer in the world. So there is significant capacity. So some portion of it is going to optimize the usage of that particular capacity, especially on healthcare sector, the life sciences part, pharma part. And this is the place where machine learning and AI is going to play a very, very pivotal role. So when we say machine learning and AI, how exactly it is going to add value, or where will machine learning and AI coming into picture? Now, based on our past experiences working with various API manufacturer, pharma manufacturer, we have realized that typically 60 to 70% of the capacity is utilized fully. Then there are best case scenarios where people use around 80%. But on an average, we have seen that the capacity utilization of 60 to 70% is a norm. Now, where does it go? Maybe your yields are not optimal. There are few batches which get rejected because of quality. And mind you, these are very important metrics actually. When we say 30% unutilized capacity, why it is important? Because if you take any pharma procedure, the total cycle time is in hours, 36 hours, 50 hours. In case of vaccines, in case of antibiotics, in case of biochemical processes, the duration is even longer. We know fermentation typically takes 100 hours for one batch to come out. Now, imagine increase of certain percentage points, 10%, 15% to the existing capacity without doing any additional capex. That is a huge number we are talking about. And that is a power of AI and machine learning, which can be utilized in this particular sector. So let's be a little concrete and see where exactly machine learning and AI how this is going to pan out totally. So if I have to talk at a very, very broad level, we are talking about, looking at the end-to-end process, right from entire manufacturing value chain, right from raw material part till in-process parameters and finished goods, FG. So we need a mechanism using machine learning and AI, which can integrate this data, which can look at these processes together and then identify a pattern which can be correlated with the outcome it has produced. So the way it will work is, let's say you have a batch which has, let's say 10 batches, which have produced fantastic yield, best output. So you look at it that for all the patterns through raw material, through in-process parameters, which parameters contribute most when you get a good batch? Which parameters contribute the most when you have a bad batch? And moment you have a mechanism to do this pattern analysis, because pattern analysis is not so easy. It is just not about looking at the data. Imagine hundreds of parameters which are continuously changing across hundreds of hours, and you need to do this analysis for last 3 months, 8 months batches. It is humanly impossible to identify such a pattern. And that is the power of ML and AI. So these algorithms will sift through this information and clearly tell that, hey, if you follow these patterns or parameters, you are going to get a best yield. And these parameters are not going to be something out of the blue. They will be very much part of your validated SOPs. Let's say your SOP parameter is talking about the temperature should be maintained between 25 degrees to 31 degrees. So machine learning and AI is not going to tell you that it should be 35 degrees Celsius. No, it has to be within the validated range, which is GXP compliant range. The way it will tell is that, let's say if your range is 25 to 31, if you are able to maintain between 27.8 to 27.2, then probably you are going to get the best deal. Imagine such parameters which are runtime given to the operator, who can actually make an informed decision that, okay, this is what my my algorithm is telling me. If I change it, then I'm going to get this much amount of yield. So amount of empowerment this is going to create in terms of production capability increase, in terms of yield, it's going to be phenomenal. And we are at the cusp of it. This was the need of the hour. Unfortunately, we needed a pandemic to really understand this need. But nonetheless, now everybody is focusing on it. So very, very bullish on the overall growth story of healthcare, pharma, life sciences companies in the days to come. So before I sign off, wanted to quickly introduce myself. My name is Suyog Joshi, and I represent a company called Nivi. We are essentially data analytics, machine learning, AI company, and we have a product called as Golden Production Run, which essentially helps manufacturers identify such patterns and optimize the capacity, which is currently lying idle. It is with you, and there is a good scope of improvement. That's what we enable for pharma life sciences companies. I hope my session could add some value to you in terms of knowledge about machine learning and AI, where it can be utilized and how much are the benefits. Thank you very much.
Thank you, Mr. Suyo, for that fascinating talk. The key is indeed not to be threatened by the unexpected and to learn to leverage technology to find innovative solutions. At Health Analytics Asia, we believe that in order to thrive and not just survive in the post-pandemic world, we need to invest in data, especially health data that is easily accessible to everyone. Data Lead's dynamic data editor, Anuja Venkatchalam, is our final speaker for today, and I'm delighted to welcome her to share with us the possibilities of a data-powered future.
Hi everyone, my name is Anuja and I work as a data editor at Data Leads. I'm very happy to be here at the Health of India Summit 2021, and I've been invited to give a lightning talk. I would like to take the next 5 minutes to talk about Crux, which is a new initiative that Data Leads will be launching soon. So, statistical facts about health are often hidden behind large swaths of data. For example, did you know that only 22.1% of deaths in India are medically certified? Did you also know that there is a 35% drop in rates of stunting among children aged below 5 years? But while the rates of stunting are on the low, the number of children with obesity is on the rise. Did you also know of the large gap in life expectancy between high-income and low-income countries? Women in high-income countries are expected to live 7.8 years longer than women in low-income countries. And similarly, men in high-income countries are expected to live 6.8 years longer than men in low-income countries. With Crux, our objective is to make health data more easily accessible to the public. So as you might already know, gathering and analyzing health data requires time, effort, and oftentimes technical skills, as you need to go through multiple websites and gather data that are often only available in unreadable formats. With Crux, you no longer need to spend your time cleaning and analyzing data. You can simply log on to www.crux.in and search among millions of data sets using a simple keyword search. What's more, we also have infographics that have been created by us after analyzing these data. So if you're working on a report or a presentation, you can simply log on to Crux and download the infographic of your choice for a small fee. Over the past few months, we've also been working on creating dashboards in health. We want to synthesize trends, especially for diseases such as cancer, tuberculosis, and coronavirus. At Data Leads, we're committed to creating greater awareness about health. And with our new initiative, Crux, we hope to create the largest database on health. If you would like to support us, you can support us by becoming a member. Do follow us on social media to hear about the launch. And if you're a health organization who wants to collaborate on collecting primary data and health, please do reach out to us. Thank you so much for your time. Have a good day.
Thank you, Anuja, for that sneak peek into Data Lead's soon-to-be launched initiative called Crux. The ambition is to be the largest health database in the world with easy access to healthcare data. When we launched Health Analytics Asia in July 2019, yes, we'll turn 2 this month, the idea was to tell healthcare stories driven by data, because stories have the power to transform the future. I want to thank all the speakers today for sharing their inspiring narratives. In today's uncertain, fast-changing terms, we need these dynamic measures and positive changes more than ever before. What we did yesterday will not be enough for tomorrow. It's time to reimagine the future. On that note, I will now hand over to my colleague Surbhi. Thank you for joining us today for the Health of India series, Maharashtra.
Thank you so much, Jisha. And a big thanks to all our Trailblazer Flash Talk speakers for being a part of the series, the first Maharashtra e-Summit that we started with today. Excellent discussions, and I'm sure this is like Jisha had summed it up and said, this is the time to reimagine the future, and this is exactly what we are wanting to do. I'm sorry we've already overshot on our time. We thought we would wrap it up by 12, but this is such an important topic that that actually exceeds the time limit. So thank you so much, everyone, for joining us. But before anything else, I think first I would let Syed talk about the entire session and sum it up. And
no, I think Surbhi, this was really insightful, and I really thank all of the speakers who participated, and I think everyone made a insightful a point about how we should really look at the future, no matter how bleak the present situation looks. And I strongly believe, as we discussed in the first session again, and then in the speakers in the second session, there are solutions to every problem. And the human behavior is whether we are ready to share our ideas, to share a place with other and have a dialogue, start a conversation. When people start understanding each other, they start understanding the strengths of different partners, collaboration happens. And then you start rebuilding, and then you start shaping the future. So collaboration is really the crux, not a single one, you can say a person or a company or an organization or a ministry will be able actually to deal with the challenges of the future. The future is in collaboration, working together and building strength, picking up key things from one and matching those with others and trying to understand our own weaknesses, of course, but also our strengths. I think we have incredible space, despite of all the difficult and unprecedented situation we are in. There's an incredible space to do new things, and we need to be ready to invest in new ideas, even in the worst situation. Invest in human resources and invest in the future, because as you know, we are calling the whole series is like reimagining the future, looking at a larger, bigger picture and seeing how we will reach there. So this was the start today with the Health of Maharashtra, Health of India Maharashtra edition. And we are going to keep this discussion continue. We're going to meet again in some time, and we will really make sure that we include more and more people and have a more participation as well. We're really looking at questions today. I was feeling bad we're not able to take all the questions, but I know we have a very learned audience here, people from WHO, people from who run hospitals, who run ministries, young doctors, health journalists, everyone. And I thank you all for joining today. And your questions were just amazing. We just were not able to take them, but we'll make sure in future we have more space to have your questions answered and have a discussion. So thanks again, and be safe, be strong, and take care. Thanks a lot. Thank you so much.
Thank you so much, Sayed. I think, yes, that is the perfect takeaway for today is collaboration is the key. Before we say thank you to everyone, I would want to take this opportunity to thank our partners, specifically here for making this possible. A big thanks to SAP and Entity Data Business Solutions for making this possible. Without your support, this wouldn't really have been possible. And I'm sure we'll be able to replicate the dialogue and take the dialogue forward in the other states as planned. We will do it in 7 other states and even more for that matter, because right now I think it's important to start a conversation on the future of health. On that note, a big thanks to all our speakers, to all our participants for being present here today. Thank you so